And when you talk about augmenting therapy, you mentioned fasting. It gets me thinking about using that as a tool for somebody that is following at least a partial conventional treatment
Yeah.
and getting chemotherapy. Talk about how somebody can use that as a tool to go along with that to help that treatment become more effective potentially and to help with symptoms.
Yeah. I think the first person that I saw observed in the literature that was doing it was Dr. Adrienne Scheck, and she was at Barrow Neurological Institute. She's a great friend and colleague of mine. She would be great on your show. Actually, she was doing radiation in a GL261 model of glioblastoma and showing that doing radiation therapy, temozolomide by itself, and then looking at tumor growth and then the death of the animal. And then she would do a ketogenic diet after the tumor implantation and the tumor growth, and then couple that with radiation or chemo and seeing extension of survival. And then ultimately, when she was tweaking the diet and settled on a dietary formula, she was able to cure cancer in this particular animal model that I don't think people have using chemotherapeutic drugs. When she coupled the ketogenic diet with radiation and chemo, in some cases, she was able to basically put the animal into remission from this advanced, and Dr. Seifrid would argue with the efficacy of radiation therapy as a therapy that would increase the overall survival in patients. That he may argue that, which he rightly so, and he's written papers on this, that it damages the microenvironment in a way that can feed the tumor. And I'm not going to argue against that, but I think in some cases, debulking especially can be very therapeutic, and certain targeted radiation therapies can be advantageous for some patients, I think. But that I think patients need to question their doctor, and then when we come to and that's radiation in and of itself without a ketogenic diet. So when you couple radiation with a well-formulated ketogenic diet, and you're working in the capacity of what's feasible with the patient, with their metabolism. Sometimes there's dexamethazones involved, and that can increase your glucose. But when you have a well-trained dietitian who knows the art and the science of doing this, they're able to adjust the glucose ketone index within that 1 to 3 range. And that largely mitigates many of the side effects associated with radiation, including reduces the inflammation, reduces the associated necrosis, and gets insulin and glucose and inflammatory cytokines. It reduces these things in a way where side effects are dramatically reduced. There's some patients that communicated with me that they didn't have any side effects at all. Like even with the dexamethasone, they could keep a glucose level, at 70 to 75 milligrams per deciliter, or close to 3 to 4 millimolar, and maintain that. And that would be the highest that it gets. I mean, these are, not all patients can do that. But, on the other hand, if they were not following a ketogenic diet and were just following the recommendations for nutrition, their glucose would be in the mid 100s, would be double that for sure. So that's having a tremendous effect on the outcome, but also the side effects. So the first thing we need to do is not like eliminate the standard of care and just go. I mean, at least from a research science point of view, and getting this accepted into the mainstream oncology centers like the Moffitt Cancer Center, which, we collaborate with, MD Anderson and other cancer centers. It's true, they do make their money off giving therapies, right? They do make their money off giving chemo, radiation, and many cutting-edge immune-based therapies. And I do think there's a lot of potential for PD-1 inhibitors and other checkpoint inhibitors to synergize with a ketogenic diet. And when I say synergize, that would enhance the efficacy, but also reduce the side effects.
When we just got into that side effect piece and
Yeah,
increasing efficacy, you focus mostly on radiation. I thought it was more
yeah.
chemotherapy, but it sounds like it's both.
Well, I mean, chemo therapy has systemic side effects, and chemotherapy is a carcinogen, right? So you're giving a poison to kill off, ideally, proportionally more cancer cells than healthy cells. But the problem with chemotherapy, obviously, is that when you chemotherapeutic agents are delivered, they're toxic to your normal healthy cells, but that also includes your immune system. So your immune system has incredibly fast, rapidly dividing cells that maintain immune surveillance, right? And and I think that's really important to appreciate that that when you compromise your immune system, a big part of getting cancer is failure of the immune system to recognize. And there's various killer cells and a whole host of cells that identify certain surface markers, and then the body can then neutralize and kill cancer. And that is largely abolished after you do several rounds of chemotherapy. And I think that's important to kind of acknowledge that could be one of the main side effects. And so a lot of times you have patients, so cancer is a disease of aging. As we age, we get more cancer. And you have like a triple whammy when it comes to muscle and function too, because you have age-related sarcopenia on top of chemotherapy-induced muscle wasting on top of cancer cachexia. So you have like three different things that are compromising your skeletal muscle mass, which is your metabolic sink, and creates metabolic reserve, but most importantly, creates your mobility and your ability to be independent. So all these things are kind of synergizing together to cripple the patient. So you have that going on, and then your immune system. So it makes the patient very weak. And I've seen like normal, healthy patients. I actually trained with a patient who was an elite level athlete, and that was very strong. I mean, we were doing almost the same weights and everything in the gym, and he was smaller than me, lighter than me. And he went through chemotherapy and was like, could barely pick himself up. He had, a very advanced cancer, the pancreatic cancer. And, so that is difficult to deal with. Not everybody will experience side effects. So my recommendation would be for the patient to talk to the oncologist and say, maybe appreciate the idea of giving less of a dose of chemotherapy and do more targeted radiation therapy, and to look in various different metabolic drugs that are out there. Would be, if they're open-minded about that. I mean, even things like metformin. I mean, obviously it's off-label, but if you go to clinicaltrials.gov, type in cancer metformin, I think you get like 200 clinical trials. So there's existing science and there's emerging science being done now to show that it could be a favorable adjuvant to different, therapeutic approaches.
When you talk about metformin, it gets me thinking about natural products that have a similar effect, such as berberine or cinnamon, to help manage blood glucose. How do you feel about those?
I think cinnamon's great. I'm like a cinnamon freak. I get like probably a teaspoon or tablespoon of cinnamon every day. I think berberine is very interesting and has a lot of potential behind it. I have experimented with dihydroberberine, which is in a product by Optimizers makes, and I used dihydroberberine, and it's a formulation with a few other things. And I took a dose of carbohydrates and had a CGM response before and after berberine, and berberine knocked it down maybe 25%. I think berberine is great for people who are insulin resistant and have problems reducing their blood glucose. I'm also of the opinion, like, the less supplements and drugs you can use, the better, and use these things as tools. First, nail down your nutrition, nail down your exercise, nail down your stress can augment your immune system and metabolism. Get these three pillars under control, and then add in various things one by one so you can fully understand and appreciate them helping you, but also some of the negative effects. If you just do a shotgun approach, then you don't know, like, there may be some beneficial things if you're, start taking 5 things at once and you start getting side effects, you don't know what's giving you the side effects. And I think it's important to start with evidence-based supplements that, something like alpha lipoic acid could be very beneficial. That could reduce glucose excursions with carbohydrates if you're on a carbohydrate-based diet. Things like turmeric could be used for cancer prevention. I mean, these things have anti-inflammatory effects, maybe protective mitochondrial effects. So I think from the perspective of cancer prevention, there's a lot of plant-based compounds and supplements that could be used. But even things like the supplements that I use that could be beneficial, like creatine monohydrate. If you go to examine.com, there's like a number of studies on creatine and cancer that, you have favorable outcomes, people using creatine. It's super safe. It's the most studied nutritional supplement in the world, and it can increase your strength and preserve muscle strength and function, throughout your therapy. So there's simple things like that are cheap, that are safe. Cancer patients have no idea, the cancer patients going to the major centers have no idea, probably never heard about creatine monohydrate. And, it's a simple supplement you can get anywhere that can have a noticeable effect on your strength and preserving muscle mass and cancer outcomes. There's research behind this.
Any other supplements while we're in this topic that would be good for people to consider, whether they're treating cancer or being preventative?
Yeah. Well, if you're following the ketogenic diet, carnitine is a good one. I like to use acetyl L-carnitine. It crosses the blood-brain barrier. That's a good one. Magnesium is excellent. Magnesium's involved in hundreds of different biochemical reactions. Most people are deficient in magnesium. So that's an important one. It's really important to keep your electrolytes up. And this took me a while to appreciate, but calcium, I was under the impression, I used to take a calcium supplement, and then, there was some cardiovascular, some papers that came out to suggest that calcium may not be a good thing to supplement. But when you have calcium in your arteries, that's like more of a side effect of what your body is doing with the calcium. But what I've observed, and when I went, I've learned from the paleo community, but also in the farming community, is our soil is highly deficient in calcium. So very deficient. I mean, it's, part of fertilizers and things like that. So calcium's super important. I would recommend that at nighttime, different forms of calcium, magnesium, and actually I use a ketone salt product, Keto Start. It's by Audacious Nutrition, and it has beta hydroxybutyrate that's spread out across the electrolytes. So you have sodium, which you really need to get sodium. Some of the carnivore people say 20 grams of sodium per day I don't know if you need, sometimes I get that much because I'm in Florida and I sweat a lot. So sodium, Keto Start has beta hydroxybutyrate ionically bound to sodium, potassium, calcium, and magnesium. So you get a balanced electrolyte. The electrolytes are really, really important. So calcium can also bind things like oxalates and help your body kind of eliminate them. But most importantly, I think calcium is a really good buffer in your blood and reduces acidity. So you have monovalent and divalent cations are like super awesome buffers, and they help eliminate some, plant toxins if you are eating salads and things like that. So are beneficial. So beta hydroxybutyrate salts, Keto Start is the one that I use. MCT oil, I use a product called Keto Brains, which is alpha GPC, MCT oil, theanine, and lion's mane. So, I mean, I just like that product. It gives me a good buzz when I'm writing. But other than that, vitamin D, if you're not getting a lot of sun, and K2. And then I eat a ton of fish, mackerel, sardines, and anchovies, which I stay low on the size of the fish to reduce heavy metals. I eat massive amounts of fish, pounds of fish per day prior to getting blood work and doing a hair analysis. And my heavy metals tested to be like in the low end of normal. So that was very reassuring that the type of fish that I'm eating has a very low toxin amount. So I looked at everything and did several tests. And so if you're not eating sardines, mackerel, anchovies, or just salmon and fish in general, I think it's really important to supplement omega-3 fatty acids because these have been shown in clinical trials, a lot of animal work to have an anti-catabolic effect. Some cases an anabolic effect. So they help not only reduce inflammation, actually they may have an anti-catabolic effect by reducing inflammation. So so I add omega-3 to the list. I said I'm not a big fan of supplements, but it sounds like I'm saying a lot of things. But I do think that that's kind of like that's what I take personally. And then I think that patients should probably get a workup. Like Genova Diagnostics is a great company where you can get tests done to look at your nutritional status, and then from there, then you could decide what you need. So it's not a good idea to supplement high dose of B vitamins if you're not deficient in B vitamins, because high doses of B vitamins could actually fuel cancer in some cases. That's a controversial theory, and also vitamin B1 or thiamine may be deficient in some people. So that's another one, especially if you're taking some drugs that we've worked with in the past, like dichloroacetate. It activates pyruvate dehydrogenase complex, which then can make your body deficient in thiamine. You want to take, if you do that, you want to take alpha lipoic acid and thiamine to help, fuel that reaction. So it's kind of depending upon the therapy that the person is taking, but I'm not a big fan at all at megadosing vitamins or certain supplements. So strategic implementation of things, ketone salts, calcium, sodium, magnesium, these things are really important. And MCT oils, these things can help lower they kind of hack your GKI, if you will. Now, I get a lot of questions because most of our research has been published on ketone esters, right? Ketone esters are exogenous ketones that are very powerful, and they have anti-seizure effects. They also have anti-cancer and anti-catabolic effects. So a lot of what we've published have been ketone esters simply because that was what was available back then. Also, animals are hard to get into ketosis, so you have to use these very powerful ketone esters to really induce and sustain ketosis. I worry a little bit about administering a high dose of the ketone ester because it could potentially reduce your body's ability to make ketones. And it's doing that by virtue of an elevation of insulin. So the ketone esters do this. So we work with 1,3-butanediol acetoacetate diester. We've worked with 1,3-butanediol beta-hydroxybutyrate monoester. We've worked with a glycerol triester of acetoacetate and beta-hydroxybutyrate. So you don't need to know the terms. Just understand that I'm of the opinion, even though I've published on it, I'm of the opinion that ketone esters are not ideal for the metabolic management of cancer. I think we still need to do research on them, and I think they do have real side effects. We've killed animals administering ketone esters. That said, I do think they have incredible capacity when the safety studies are done to be used in cancer therapy under certain conditions. I would default to simple things that you can get in the health food store: MCT oil powder. And then you have ketone salts, which are beta-hydroxybutyrate. You could administer as a salt. KetoStart is one. There's the free acid of beta-hydroxybutyrate, although that's one of the first things we tested. And I think there's some supplement companies came out with it, but really you want the salts because you like to get the acid reducing buffering effect of the electrolytes, and that can help out. So I get a lot of questions about exogenous ketones, and I do think they are a very powerful way. I've seen people with a GKI of 5 or 6 do nothing but add exogenous ketones and then be able to maintain a GKI of 2 just by supplementing 2 or 3 times a day exogenous ketones. And if you look at their insulin levels, it's normal. I consume like the highest tolerable dose of a ketone salt, like 2 packets of KetoStart. And then an hour later, pricked my finger and measured insulin, and there was nothing. And then I administered our ketone ester and then I measured insulin, and I saw that it popped up. It popped up only from like 3 to 6, but that pulse of insulin could activate cancer. It's not doing you any good, I think, even though your ketones are high. And also, if you consume a ketone ester at a dose that elevates your ketones, whenever you get a delta of 2 millimolar or more, that's releasing insulin. So what happens is you consume the ketone ester, your ketone levels pop up to like 3 or 4 millimolar. And then 2 or 3 hours later, your ketones are back down to baseline and maybe lower than baseline, because the insulin is going to reduce your hepatic ketone output. But 3 hours later, you're hypoketotic and hypoglycemic, and then that can trigger a headache. And if you see, there's a couple clinical trials that came out with like 1,3-butanediol. They're selling it as a ketone ester, but it's really not ketone ester. If you esterify that to ketones, then it's an ester. And I don't want to confuse people listening to this because it may sound highly technical, but I think the important thing is that I think ketone esters are powerful. They need to be more, safety work needs to be done in the context of cancer, and that there are significant advantages to using ketone electrolyte salts, and that people should not fear salt. They should not fear sodium. They should not fear calcium. They should not fear magnesium. These electrolytes are beneficial. They help buffer your blood, and they have very favorable effects, like in general.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
These are really important things that an oncologist is never going to tell the patient to do. Hyperglycemia and hyperinsulinemia is associated with much greater, sometimes